about impact of COVID-19 pandemic on families in terms of ethics. Impact of COVID. Let's start from that. The coronavirus, COVID-19, has spread to all 20 countries and territories covered by UNICEF, which comprise of about 2.3 million people, of which 26% are children. It has severely impacted all areas of life and is as much a health crisis as a social economic threat, creating extremely challenging situations. The unfolding situation has disrupted all aspects of life. For example, resulting in school closures, loss of jobs in the heavily tourism-reliant economies, heightened food insecurity, important and overburdening of already challenging government system. All countries have temporarily closed pre-primary, primary, secondary schools and universities, and over 500,000 children are at home now. The closures are directly affecting learners and their parents, further straining family coping capacities and disrupting children's education for the foreseeable future. The evolving situation requires innovative teaching methodologies to be rapidly developed and implemented to continue learning. Children and their families are also suffering large-scale disruptions of basic social service, and their access to health, food, housing, minimum income, and safe social interaction is increasingly affected. There are vulnerable groups who risk falling through the cracks in the current crisis, which include children in institution and detention centers, which total approximately 1,021. 1,021 children across the 20 countries and the estimated 33,000 migrants from Tobago. UNICEF has more than 70 years of experience ensuring the health, education, nutrition, and protection of children, especially those most in need. The organization has been working with the small island developing state, the Eastern Caribbean, since 1950s, and has supported the sub-region during some of its most challenging times. UNICEF has an integrated approach to address the needs of children throughout their life cycle. UNICEF brings public and private sector actors together to find multi-stakeholder solutions and has a unique dual humanitarian and development mandate to work towards the realization of the rights for children in emergency and development settings. Important ways to slow the spread. Launch hand washing companies in centers, schools, health facilities, and public spaces to improve preventive practice among children at risk groups and the general public. Support innovative approaches to communicate with communities remotely. Ensure children and their families know how to prevent COVID-19, seek assistance. Coordinate with the authorities to track and respond to misinformation and ensure children and their families know how to prevent COVID-19 and seek assistance. The COVID-19 pandemic can have serious consequences on the lives of boys, girls, and adolescents. UNICEF calls upon the international donor community to prioritize the need of children and their families as part of the international response to the crisis. The consequences of prolonged funding gaps will hamper UNICEF's capacity to address urgent needs and mitigate the medium and long-term effect of the crisis. In order to provide urgent and adequate response to the COVID-19 crisis, UNICEF Eastern Caribbean Area Office will open $2 million to support the government of Anguilla. In conclusion, to overcome the COVID-19 pandemic, in many places throughout the world, new researchers were developed in a short period of time, dramatically increasing the number of beds, allowing admission of a huge number of critically ill patients. The massive patents influx heightened numerous ethical concerns that ICU carriers are likely to face. That's all about my part. Now I want to give floor to Haydar. That's all.